Because the status quo, as you just saw, there have been today or yesterday, a carrier in Maryland put a request in for a 59% premium increase for their plans in Maryland. I know here in New York, the carriers in our general region, be prepared. You're going to see premium notices that are coming down the pipeline here very shortly of the 30 to 40% level. I know that we have insurance carriers that are pulling out of markets, limiting choice, that are causing people to have no choice to get health care. This present path we're on is not sustainable. I also know, so what I think we want to do is, I would hope we can find common ground to make it a right that is enjoyable and accessible and affordable for all, and is sustainable. I promised to individuals that have supported us to repeal this legislation, and for the sake of having better health care, we need to do better than what the Affordable Care Act is delivering for people in America. So what I look for is hearing the concerns about folks during these town halls about the disability community. Hearing the concerns about seniors and older Americans who are fit. That's why when we went back to DC, we advocated for that bump up, because those stories resonate with me. I listen to that. That makes an impact. But it doesn't mean we're going to fundamentally
because it represents your constituents.
Because I believe that in the best interest of the people we represent, we have been clear in our position on this and where we're going.
The latest poll has a 17% approval for the bill that you just voted for. Quinnipiac had a poll last month at a 17% approval for this bill. How can you say you're representing your constituency when only 17% of the U.S. population is supporting this?
And that's fair. That is one of the reasons I do these town halls, that we try to get out there, people know where we stand on the issue, and to have a conversation. We are standing for all 717,000 people we represent. And I believe, and we have been clear when we believe, that the policies of going down big government, single payer type of health care are not the outcomes that I support, that we want to advocate for.
What about we support?
A market, a state-based system going. I support lowering the tax burdens across the board for everyone. And that is what we do.
Speaking of taxes, when are we going to see Trump's taxes? Yes! I want to hear
As we have put on the record.
The tax code until we get to see his tax returns to see what he's getting. Or yours. Everybody else.
Would you want to look at that up? I don't know.
I think it would be good if you would explain to the people what the difference is between health care that is not denied to anyone and health insurance. Health care costs just like your groceries cost money. You go to the store that gives you the best deal, correct? The same with health care. Now don't confuse health care with health insurance. If the government keeps its fingers out of the business, as I mentioned to Tom, the government has no business being. But, yes, but I am not. Come on, don't shout each other down. If you're Americans, then act like Americans. Let me say it again. I came from a country where I was opposed by an invader. I know what it is like to live under dictatorial rule. And what some of you people are doing, you're trying to dictatorially rule this meeting. Give this man an opportunity. And keep stopping your shouting.
Who paid you? Bring her!
And as we started the meeting, everybody has a right to speak. And that is why we try to listen to all the voices. And clearly, there is a disagreement on the issue of healthcare in America. There's no doubt a disagreement. And so what I try to do is find the areas, so recognize we disagree, where can we work together? To the gentleman's point, there is a difference between health insurance and health care. And this bill does a lot in regards to health insurance. We still have to have a conversation in America about health care. And that is my hope, that there is going to be area that we can come to an agreement on when it comes to making health care more efficient and effective. I have been very supportive of the pharmaceutical reforms in order to make more transparency there, in order to drive prices down, because once you put sunlight on some of these individuals that are engaging in these egregious behaviors, it is amazing how quick they change their behavior because of the pressure from folks like us and you that are raising the